Good evening.
All right, we're actually recording. Thank you for that reminder.
Hi, Elizabeth. Hello, hello.
Hello.
You're on mute, please.
Feels like the reunion tour.
I know, right? Yeah.
Hi, Tabitha. Everybody.
And Nazo, Ruben. Good to
Nice.
see you here.
And just a reminder,
Hello,
for
hello.
everyone, if you want to
Hello.
see each other more often, that the cast meeting we have it the second Thursday of every month at 8 a.m. from 8 to 9:30. And we get down to like the nitty gritty of what's going on in each, in the community and all the resources. And so if anybody wants to join those, just put it in the chat and I'll make sure that Bishop Bowser or Pastor Patty B or Pastor Archie can send out the link to that. All right, we'll wait about another minute and then I guess we could start off with introductions, Dr. Hood. And then we'll see who's who and who's representing what region or department. And then I'll check off as people are being introduced to see if we have the quorum.
Yes, sir.
Okay. Ruben. Chief Ruben, all right. All right, I guess it's 6:05, so.
Okay. So welcome, commissioners. I'm going to officially call the meeting to order at 6:05. And why don't I just start it off for the roll call. And I'm going to ask if somebody's sitting in for a commissioner when that position is called, for them to introduce themselves and who they're sitting in for. So my name is Dr. Rodney Hood. I'm chair and I'm the public health representative. Dana?
Thank you so much, Dr. Hood. Commissioner Dana Brown representing District 7 for City Council. Grateful to be here with all of you.
Jamie?
Commissioner Jamie Wilson for District 4.
Thank you. Dwayne?
Dwayne Woodley, I'm Assistant District Attorney on behalf of DA Somerset.
Okay. Tabitha?
Did you say Tabitha?
I did.
Okay, good evening, everyone. I'm sorry, Tabitha Wilburn. I'm a division chief with probation.
Okay. Okay. Ms. Gross?
Hi, everybody. Sonia Gross with the San Diego Workforce Partnership.
Okay. My friend Ruben?
Good evening. This is Ruben Leyva, Assistant Chief with Probation, sitting in for the commissioner spot with probation and interim chief Cesar Esquero.
Elizabeth?
Good evening, everybody. It is Elizabeth Bustos representing Health and Human Services Agency for the County of San Diego.
And Mr. Lasner?
Good evening, everyone. I'm David Lasner. I'm the Deputy United States Attorney, and I am attending this evening in place of Acting United States Attorney Randy Grossman. It's a pleasure to be here.
Thank you. Welcome. Do I see Michael?
Good evening, Mike Morrow, representing District 2.
Ronald Van?
Good evening, Supervisor with Probation, and I supervise the Juvenile Gang Unit.
Okay. Stefan, I think we're going to hear from you, but why don't you just let us know who you are?
Stephen Abrams. I am a youth rep on the San Diego Gang Commission from the Youth Committee, as well as I am a part of Team Enough, which is a youth gun violence prevention organization that is the youth program at Brady that I run. So that's actually where I'm at. I'm at the Brady headquarters.
Okay.
I'm glad to be here.
Okay, and I see Gonzalez.
Good evening. Thank you, Doctor. Jorge Gonzalez with Adult Field Services from Probation.
Okay. Commander Chuck Chinaram.
Good evening, everyone. Commander Chuck Cinemo from the Sheriff's Department here representing Sheriff Gore.
Thank you. Dr. Tran.
Good evening, everybody. This is Dr. Vin Tran, and I represent District 6.
Welcome. Orlando.
Good evening, Orlando here. I'm with the Adult High Risk. I'm sitting in for Supervisor Mitchell Rodriguez.
Okay. Beto Vasquez.
Hi, good evening, everyone. Beto Vasquez, representing District 8. Thank you for having me tonight.
Thank you. Orlando Villanueva.
Orlando Villanueva here, representing Adult High Risk. I'm here for Supervisor Maritza Rodriguez.
Okay. And I'm going to call out the phone number. The phone number ending in 4489.
Good evening. This is Julie Epperson. I'm sitting in for Chief Neslight and for Captain Friedman.
Okay, welcome. And the phone number ending in 6385. If you can unmute, phone number ending in 6385. Do you know who 6385 is?
No, it doesn't look familiar.
Okay. Well, I'll just leave it. We may have to, not sure who that is, hide non-video participant. Is 6285, can you hear anything? Okay. So I'm going to suggest if we can't identify who it is, that at some point in time, I don't have control, but I'll give him a few minutes. But if we can't identify him, I think we should try and block him out of the meeting until we know who he is. Okay.
Okay.
And don't ask me how to do that. Okay. Anyway.
Hi. Excuse me. I think that is my partner, Lieutenant Mike Ramsey. I think he's having some issues with his audio. He just texted me, but that's Lieutenant Mike Ramsey from San Diego Police Department Gang Unit.
Okay. Thank you very, very much. Appreciate that.
Yeah, no problem.
Okay, thank you for the roll call. I want to welcome the commissioners to this meeting. Our executive director sent out minutes from July 1st, 2021. And I'm hoping that the commissioners have had time to review them. And I'm looking for a motion followed by a second to approve. Is there a motion? Okay, I see a motion to approve by Commissioner Dana Brown. Is there a second?
I'll second that.
Okay.
With the correction, please.
With the correction that Dana Brown had noted to Pastor
Okay.
Sandoval.
Okay.
Horace
yeah.
Mann, for those that have just hopped on, the top of page 2, it says
Okay.
Horseman, and it should be Horace Mann.
Okay.
Thank you, Michael.
Okay,
no problem.
Thank you.
Okay. So it's been moved by Commissioner Brown, second by Commissioner Morial with the correction of the typo. Any other unreadiness? All in favor of adopting the minutes, just wave your hands to me. And those on the phone who voting, just say aye.
Aye.
Okay.
Aye.
Okay, minutes have been approved. There being no formal presentations, correct, Pastor?
Yes, no formal presentations, and did want to use that as a reminder that all commissioners, if you have something you would like to highlight from your programs, if you can just shoot me an email or Dr. Hood, and then that way when we're creating the agenda, we can go ahead and plug you in. We do have 2 organizations that are coming up for presentations, but if you want to highlight, success story, a person, an organization, or just work that you are involved in that aligns with the tactical plan, just shoot us an email, and we'd be more than happy to have you present with the PowerPoint and a video, just to bring awareness to what you do in the community and that kind of stuff.
Okay, thank you. And we're at the point for public comment. Is that available?
No emails came in for that, for the online.
Okay.
And so if there's any of the commissioners, if you invited anyone from the public through a Zoom link, if there's anyone online now that would like to speak, if you can identify yourself, first name, last name, and then we'll be able to do so. I did also, just to note, a few folks came in while we were doing the meeting minutes approval. So if they can introduce themselves.
Okay, so nobody from the public, and I'm going to go back to the introductions. Those who were not during the introductions, if you could just speak up and introduce yourself. I'm not sure who is that. Villegas?
Good afternoon. Thank you. Noemi Villegas. I am representing San Diego Unified District Schools, as we have an interim superintendent at the moment. And they have asked me to come and attend, and I'm happy to see you all. Thank you for the invitation.
Okay. Thank you for that. Did I miss anybody, Pastor Sandoval?
I think it's a phone number, unless that was the same number.
I think it's the same number.
Okay.
Yeah.
Okay, we're good then.
Yeah. Okay. So thank you for that. There are no commissioner highlights. There are no action items. And so I'm going to move to the information scan. I'm going to ask for update of the wide gang case statistics involving the San Diego Police Department, the representative of Commissioner in Chief David Neslett.
Hi, good evening, everybody. Lieutenant Mike Ramsey with the gang unit. Hopefully you can hear me now. Is that correct?
Yes, we can.
Okay. I apologize for the speaker problem I was having, but seems like it's fixed now. So I will give you an update on the current statistics. This goes through the month of July. We haven't finished computing August. So for the month of July, we had 2 gang homicides, and that's a total of 9 this year, which is increased by 5 since the same time last year in 2020. We didn't have any attempt homicides, but those are still up. We have a total of 5 at this time, which compared to 1 last year at this time. Assault with a deadly weapon cases, we had 4 in July, total of 21, right? Or I'm sorry, 71 in 2021, which is up 17. from 2020 at this time. Shooting at houses or vehicles, we had 2 in July. There's been 14 so far this year compared to 5 in 2020, so that's up by 9. Robberies, there's been 2 in July, total of 19 for 2021, which is actually down 11 at this time compared to 2020. Auto thefts, we had 4 for July, a total of 35 this year in 2021. That's up 8 more than 2020. And then for the firearm recovery, at least for the gang unit alone, we're at 135 right now, year to date. We had 28 in July, and that 135 is up from 52 last year at this same time. And for gang population, we're at about 2,300. That's down about 375 compared to the same time last year.
Okay.
And that's the current stats I have.
Okay, thank you very much. Do any of the commissioners have any questions for the report? Pastor Sandoval.
Yeah, is there any distinction between regular guns that are being confiscated versus the ghost guns? For
yes, there is. Yes, there is a distinction. We are keeping track of those individually. So out of the 135 year to date, 43 of them are ghost guns, and that's 10. There was 10 in July, and that's certainly up from 2020. And that's just for the gang unit. I don't have the department numbers with the total ghost guns department wide.
Okay. Any other questions? Commissioner Brown?
Just curious if it might be possible. I know you're representing statistics specific to the gang unit, and I know Stephan Abrams will have a recommendation later during the youth committee share out specific to ghost guns. Would there be any possibility of in the future having, like you shared, it was 43 out of 135 to date ghost guns for the gang unit and all the units throughout SDPD? That I think that would be fascinating to hear, because our commission really wants to lean in being part of the solutions in our community. So I was just wondering if that might be a possibility. Thank you.
Yes, I certainly can look into total firearms recovered by SDPD, and then out of the total, I could look at the ones that also fall into the ghost gun categories.
Thank you so much.
You're welcome.
Okay, thank you for that report. And I see no more questions, so I'm going to move to the next agenda item, and that's a report from the probation department.
Well, good evening, everyone. We've got a team of probation folks who are highly charged and excited to report out what's been going on at the probation department. We have, in typical fashion, 2 separate reports that'll take place. One will be our youth development and community support services division, and then followed them by our adult group. And so Tabitha, can you have your staff take us away?
I will. Once again, good evening, everyone. I do have Supervisor Ronald Van. He's going to do the report out this evening. Since he attends these meetings frequently, I'd like for him to provide some information as well. So Ron, can you go ahead and provide the report, please?
Yes, ma'am, and thank you for your confidence. Juvenile Services continue to engage youth to refer them to resilience and mentoring programs, also to achievement and choice as well. Currently, we have 13 in the Achievement Center with 1 pending intake and 16 in choice. We have about 9 youth in the resilience program. We are seeing, last month, we did see a slight uptick of youth that were encountered with firearms. Typically, this was after hours and done by one of the local agencies within San Diego County and reported to our officers. And we have ourselves encountered some youth that have had firearms during our fourth waiver searches, but we continue to be diligent and go out and conduct our searches and keep the community safe. I do want to make a note that this last Saturday, the fentanyl awareness event that the DA hosted, we had Officer David Harris and Officer Jennifer Simone participate in that event, and they were very excited about the reaction they got while they were there. And that's all I have.
Okay, thank you.
And we have Division Chief Jorge Gonzalez, who will have his adult team provide a report. Jorge?
Thank you, Ruben. And once again, thank you everyone for the opportunity to participate. Tonight, we're going to have an update from Orlando Villanueva. So Orlando, take it away.
Good evening, folks. Officer Villanueva, Senior for Central High Risk and Adult GSU. In spite of COVID, there have been some amazing things that we've been doing in the last couple of months. Just last week, we adopted Central Elementary School, and we gave out approximately 30 backpacks, and we gave out some school materials. I know we're adult, but we do still have an impact on schools that are directly related in our region. We also last month, along with the WATCH program, which is in our high-risk unit, and the CHP, we were able to collaborate with them and give out numerous donated clothing to pregnant probationers, which was an awesome. Division Chief Jorge Gonzalez was actually there also to help us out. It was an awesome event. CHP was able to give out approximately 27 car seats. It was amazing to see the faces when they actually got the car seats, because car seats are not cheap. It's very expensive, and a lot of them were able to get those. On the inside track, we have added the alcohol and drug specialist to every unit in the region to add it on to our mental health clinicians. So we do have an ADPS assigned to every region, which will be able to help us better address and refer specifically alcohol and drug related referrals and resources that we can give our probationers. And our numbers are hanging steady. I do, again, like I was here a couple months ago, and I see this really steady growth in fentanyl. It is really growing in our adult probationers. I see it. We're getting a lot of referrals for it. I see a lot of positives for it. I think it's really having an impact on our community. I think there should be some kind of dent that we have to do, if we can do it in our department, or we can collaborate something to make this dent with this fentanyl outbreak that's coming in our community. I think that would be very impactful if we can. Other than that, that's all I have.
Okay, thank you very much. Is that it for probation? That's it. Okay.
That is all, unless there's questions, Dr. Hood.
Okay, thank you. Pastor Sandoval?
Yeah, thank you for that. Just as an FYI, the youth empowerment, they were just awarded a grant for substance abuse treatment. And so the unique part about youth empowerment along with the treatment services is that they'll have mentors with lived experience to help with navigate when participants get referred to the program, pair them up with a mentor that's been there and done that to kind of help them throughout their sobriety. And so I just wanted to put a plug in for that. If you need the person's information for intake and that kind of stuff, you can just reach out to me, and then I can help make the connection. I think they're on the list anyways for probation, but since it's fresh, I wanted to put it out there as well.
Pastor, thank you for bringing light to that. And, we love to engage with youth empowerment. Arturo Soriano, Arthur and his group just do a terrific job. And so if they have something new that they're working on, we certainly want to support them and to learn more about it. So Tabitha, if you and Jorge would sort of together collectively reach out to Arthur and find out what that is about and see how we might participate or learn more. It really sounds intriguing and quite relevant for what we're hearing about going on in the community. Thank you.
Will do.
Okay, thank you very much. I'm going to move to the next agenda item, and it's the committee updates. And we have the Outreach and Communications Standing Committee. Welcome, Commissioner Bustos.
Thank you very much. And it's good to be back from sabbatical, all having to do with what's back here, the COVID-19 response, which I was activated as part of the Emergency Operations Center. Having stated that, I have no updates at this time. Thank you. But look forward to receiving your guidance. Thank you.
Okay, well, welcome back, Elizabeth.
Thank you.
Okay. We're at the Youth Standing Committee, Commissioner Dana Brown.
Thank you so much, Dr. Hood. And we are going to have a share out today. Super excited. 2 youth leaders are here with their recommendations for you. And always with our youth committee, we always honor and start with a land acknowledgement. San Diego County has 18 reservations, more than any county in the United States, and we have 4 tribes, the Kumeyaay Nation, the Payum Kawichum, the Kapenyu, and the Kahia. And we want to acknowledge and give thanks to the ancestors of these 4 tribes, past, present, and in the future, just as much as we want to honor every single one of you and your ancestors and survivants within your DNA from your ancestors that brought you to where you are here today in our world. And so we say Hauka in Kumeyaay language, which means may the fire, may the sun that burns brightly inside your heart continue to burn brightly. The Kumeyaay language, all of the language is spoken through the heart. So every word, all their sentences, everything is through the heart. We know that the commission was unanimously voted by City Council of supporting a trauma-informed approach to address and prevent gang violence. That was in July of 2015. We know that our youth committee, which we've been around for, well, pandemic pause. We had a stall there for a minute, like we all did, but we've been around since 2017. We really aligned with our strategic action plan of our commission. It is supported by a multi-generational model, and we support youth who have been directly or indirectly impacted by juvenile and or criminal justice systems. And everything that we do in the youth committee is through the lens of equity. This is a graphic from Robert Wood Johnson Foundation, which clearly is a clear visual on the drastic difference between equality and equity. And so as you can see in the top row, all the bicycles are exactly the same, whereas they're really person-centered down below. And so that's our lens, is everything is equity focused. This is a picture of one of our youth committee meetings. We were in the annual report 2017, another meeting in November of 17, and we have a fantastic collaboration of partners during our monthly, we meet monthly the 3rd Tuesday from 3 o'clock to 5 o'clock. So we have 16 Strong Project, which is in New York. And we have youth that are all over the nation that are part of their youth advisory board. And they've been, Samantha Wetge, the founder, they've been dedicated with the youth committee for several months now. We have Access Inc., who is forming a youth coalition that is also part of our youth committee. We have Community Wraparound and Pastor Sandoval and Robert Antiveros. I know he's here this evening. Is one of our collaborative partners. We have the San Diego Juvenile Justice Commission. Dr. Tezeru Tashome is one of our steadfast, dedicated collaborative partners. And we have Say San Diego, Club Elevated, and Minor Borjas. So Say San Diego is part of our youth committee. We have Team Enough. You're going to excitedly hear from Stephan Abrams here in just about a minute or two. With Team Enough, and he'll share more with you what he does as a national leader. We have Youth Voice represented. This was one of our youth leaders. They're all trained on adverse childhood experiences and building resilience, systemic racism, systems-induced trauma, civic engagement, and advocacy, so that when they have their presentations that they do, with leaders from literally all over the world. In the center here, directly seated in front of me, you'll hear shortly from Jessica Rivera, This was when she presented at age 18 in 2018, presented on ACE of Science before 20 European leaders. And literally Jessica and Santiago have presented before. I have over 100 business cards from individuals that are leaders representing the European delegation, Near East and North Africa, through this wonderful partnership through San Diego Diplomacy Council. And this is just some group pictures of some of our youth committee meetings that we've been, that one was in, so we have January and February. We met with Councilmember Raul Campillo. He's directly under me with the hat on. He joined us immediately following the adjournment of City Council that day, and we had a meeting with him. And then our youth leaders met in preparation for our ask with him, which was Equity Focused Youth Panel that we held on June 24th with Councilmember Raul Campillo. This was a group shot that evening, actually that afternoon when we met with him. And our ask is always to continue engaging and collaborating, lifting up the voices of youth. And this is our July meeting that we had. Here's our August 17th meeting that we had. And you see here in the middle one right below me, Tezero Tashome, she's actually at Hoover High School, and she was doing a youth leadership there. So those are several different youth from different groups in City Heights. And that was in Dr. Villegas, she joined us, and Sergeant Alfonso joined us from the San Diego Unified School District. And so now that's just a little bit of background for any of you who may not be your first time here and possibly not familiar with what the youth committee is really focusing on. So now we have 2 recommendations, and I'm going to go on mute and turn this over to Stephan Abrams, and he will share with you his recommendation about the ghost guns. Thank you, Stephan, for your leadership.
Thank you. A little bit of backstory on me is that I work with Brady United, as I said earlier. And about a year ago, I had the idea when I really started researching the issue of ghost guns. And I saw how bad this issue is, also potentially not only for our communities, but also for youth at risk as well. And when I did more research on ghost guns, I actually decided to do a project on the issue where I showed a video of me actually purchasing one of these. It was completely legal. There was no ifs, ands, ors about it. It was super simple, and it just opened my eyes personally to show how easy anyone who wants to get their hands on one of these, how easy it really would be. And so I have worked along with Pastor Sandoval and other members of the Gang Commission and my team from San Diego, Team Enough, to work with Council Member Marty Von Wilpert on a ghost gun ordinance for the city. It is called the Enough Ordinance, ENUF. It is titled Eliminate Non-Serialized Untraceable Firearms. And what this ordinance would do is it would actually stop the sale of ghost guns here in San Diego. We potentially are going to be one of the first in the state of California to be able to pass this ordinance to set a model for the rest of the nation, as LA has already followed suit and San Francisco. So the ordinance actually has already passed its first reading. But my recommendation to this committee is that we support this ordinance as it goes to its final reading before the council. And also, as well as to develop is the recommendation to the commission on gang prevention and intervention for the development of a community/law enforcement work group focused on ghost guns in partnership with the San Diego Police Department's newly formed Ghost Gun Unit. Because I am pretty confident that this ordinance attacks the problem of getting rid of ghost guns in our communities, we need to make sure that we inform the public And we work with San Diego, the San Diego Police Department, to ensure that the public can effectively get rid of these on the streets without criminalizing and without actively hurting members of our community. Because part of this problem is that people don't know that they do have ghost guns. These are weapons that are being made in our communities that are really easy to purchase, and they're also sold at a way cheaper price. So of course, someone who's just looking to buy a normal firearm would purchase one of these. I can answer any questions that people may have about the ordinance or ghost guns as well, but as we've heard on this call, the numbers of even just ghost gun recoveries alone in the city of San Diego is astonishing. The numbers are scary, and it just goes to show how gun violence has just been exacerbated by this issue, because we are making it far too easy for people who should not have guns to get guns. This issue of ghost gun bypasses all of the work our legislators have done to ensure that there's processes such as simple things like background checks, simple things of like being of the age of 21 to buy a handgun in the city. These are all bypassed with the issue of ghost guns. You can be any age. All you need is a credit card and a computer. San Diego is also a place where they make these as well. They have a couple brick and mortar stores in the city as well. So this is an issue that's very close to home. And I would love to hear anybody's thoughts on this if anyone has any questions, but I think education about the issue of ghost guns in the community is extremely important moving forward. And I think it'd be great to create a working group with San Diego Police Department, especially with their newly formed ghost gun unit.
So this is Dr. Hood. So just for clarity, first of all, Stefan, thank you. I just want to be clear what this is. So the specific recommendation you're asking us to vote in support is for the development of a community law enforcement work group focused on ghost guns in partnership with the City of San Diego Police Department newly formed Ghost Gun Unit. Is that what we're talking about?
Yes.
Okay.
I was discussing the content of what the working group would discuss.
And what, so I want the commissioners to be clear as to what we're voting on. I also heard you say there was some specific law that was already being proposed?
Yes.
That goes along with this? Okay.
Yes. It's hand in hand with the with what this working group would do. So my recommendation is, of course, this commission to support the final passing of the ordinance, as well as to continue to work, form a working group around our communities.
So as chair, just let me get that clarity. I think clearly the concept is clear, and I get it, and I think I support it, but I want to get input from the other commissioners. Did they feel comfortable doing that, or did they want more specifics as to what the law was this actually represents? Or just frame it that we're supporting this concept. So Pastor Sandoval.
Yeah, so thank you for the presentation, Stefan, and also the recommendation and the work that you've been putting in. So this is just a thought, because it's not on today. We were just going to discuss it if there's any Q&A, but perhaps at the next youth subcommittee, we can invite all the other commissioners that have like the voting rights, so that they can be well informed, so that when we put it, if everyone's okay, we put it on the agenda for the November 4th meeting, everyone's well informed, and it gives everyone a couple of months to research this whole thing, so that every commissioner that's going to vote on this can be pretty well versed, at least on the basics of it. And Dana's made herself available, Stefan's made himself available, the youth subcommittee, to have that that space of just awareness and education around this. So then at the next commission meeting, we'll have it as an action item, and then everyone has the opportunity to vote.
Okay, so we're not voting on this specific recommendation. Is that what I'm?
Yes, not today. This
Okay,
is
good.
just bringing that more of awareness
Thank
of the actual recommendation. Yeah.
Got you. Commissioner Bustos.
And yes, and thank you very much. And thank you for this just wonderful presentation, and once again, reminder of the imperative to really act on this. But I'm just stepping back, looking at meeting structures, and I don't have the answer to this. And you know, I've always struggled with the Brown Act, but are these meetings or these planning meetings and everything associated with this conversation, are those Brown Act meetings? What are the mechanics and the logistics behind that? Just real basic question.
Yeah, absolutely, Commissioner Bustos. They do honor the Brown Act. Honoring process is critically imperative. So I'll draft the agenda and then email it to Pastor Sandoval and Dr. Hood, and then the city uploads it onto our commission website. The youth committee has our own little square, but it's also on the right-hand side under agendas. So it's always in alignment with, honoring the 72 hours prior and publicly posted. So yes, they are absolutely in compliance.
And thank you, Commissioner Brown, for this, because this is such a great piece of work that we want to make sure that all the bells and whistles are in place. So when recommendations, best thinking is moved forward, that it's pristine. So thank you for that. Sounds like we're well on the way.
Absolutely. And I think that we can, Stefan, you have that YouTube, right, Stefan, of you at 17 years old buying, and you gave that presentation to the commission the last time we had a meeting, I believe, or maybe the time before that, but recently. So if that's a YouTube, then we could email Pastor Sandoval and Dr. Hood this slide deck as a PDF, so it's smaller, Stefan's YouTube of him actually purchasing one of these at age 17 online. And that way all the commissioners would have at their fingertips the more information. And also if Stefan, if it's possible on that ordinance of enough, if there's any language on that ordinance that we could attach also, that way commissioners would have everything at their fingertips.
Yeah, totally agree. And thank you for that, Commissioner Brown. Yeah, I would like that information, but specifically, if you could just send the ordinance. And so that way, when we meet again under action items, this will be listed as an official action item, and the commissioners will have had time to review it.
I can definitely get the language over, as well as I just shared the YouTube link. But yeah, thank you for allowing me this opportunity.
Okay. Any other questions? And Commissioner Bustos?
And thank you, Chair. Just for, broadly speaking, what is the timeline? What is obviously immediacy, but it sounds to me like this couldn't or shouldn't be a month-to-month conversation. And I look to you, Mr. Abrams, and also Commissioner Brown, just to give us a good indication as to what the timeline is for action in this piece of work.
That's a great question. The first thing I would say is, first of all, it needs to pass the city council, but then also has to go to the mayor. So these things do take time. But already, if we are able to actually establish the fact that we want to create a working group by the time the mayor signs this ordinance, hopefully into law, and it begins to be implemented, we'll be in lockstep with STPD to ensure that we're making sure that we're getting these dangerous weapons off our streets in the most efficient way possible, without hurting our communities.
And thank you for that, Mr. Abrams. Then I think what I would, just as an ask, a humble ask from this commissioner, if whatever reporting out or summaries that are forthcoming, if they can have, just address the timeline, if you will, so we always have it at the forefront.
100%. I can, if it's listed as an action item, I can prepare an actual presentation with all these links, all these
Thank you.
ordinances, all this language.
Thank you. Very grateful to you, sir. Thank you very much.
Thank you.
Okay, thank you.
Any other commissioners? Any questions for Stefan? And then we'll move on to our recommendation.
This is Lieutenant Ramsey again. If I could just add something to the total guns. I know I was asked about the recovery of SCPD. So while you guys were going on, I did some texting and I got some numbers. So as this is through July again, so the total firearms recovered by SCPD is 1,261. And then year to date is 270 are ghost guns. And that was just 50, I'm sorry, let me make sure those numbers are right. Yeah, 270 were ghost guns.
Good, thank you.
You're
Thank
welcome.
you so much for that. Any other commissioners? Any questions for Stefan? Stefan, thank you again for your profound leadership. You just graduated high school. We're just beyond exhilarated and proud of you, and anything that we can do to continue supporting you on your incredible journey. Thank you for your leadership. Thank you for being here tonight.
I appreciate it. And, you know, this is an issue that is going to be unfortunately around, but there's a lot of localities across the state of California that are interested in tackling this issue. So I really appreciate this commission. And I would also like to say, I think I'm actually going to hop off because it is getting late here on the East Coast.
You are in Washington, D.C.
Yes, but I really appreciate this group and I'm looking forward to the next meeting.
Thank you so much, Stefan.
Thank you very much. Appreciate it. Okay.
Thank you.
So.
And this is the, just wanted everyone to see the SDPD, the Ghost Gun Unit. And then now we have our wonderful Jessica Rivera, who is from Youth Voice, and all of you have seen the Youthled Trauma-Informed Care Code of Conduct many times, as we've shared out with the Standing Youth Committee. And so now I'm going to go on mute and excitedly turn it over to Jessica Rivera.
Thank you, Dana. I was hoping we could go to the next slide so I can have that open already. Okay, thank you. So hi, my name is Jessica. I've been part of Youth Voice for 11 years now, since 2013, on and off, but I've been very passionate about speaking up about things that I feel like have affected me growing up. And now I feel like I can have a voice to that, to help future, community. So today, we're talking about the Trauma-Informed Care Code of Conduct. And this is something that is important to me because in high school, I had therapists, I was on probation, and even my mom going with welfare, we met lots of different community working organizations. And sometimes I feel like I'm a person who can tell if someone is genuine, an adult is genuine. And speaking for my therapist, I feel like that, I know she wanted to help me, but the sessions that we had together, I feel like they were more of because she was there, she was getting paid. It didn't seem that genuine. So I feel like that therapy session didn't help me at all. So this is a recommendation as well, that hoping that for next meeting, we can also have an ask to that. But it's for the mayor's office within San Diego. Or it's with the City of San Diego Council and the mayor's office in policies, procedure, and practices. So this is something that I believe was formed by the youth. It was something that we all spoke about, something that we felt like something that has affected us, and we would all came up with different, as you can see, different things that we would want that these organizations, these agencies that are working with the community to implement into their practices. And I believe it was created in 2019. I was a part of it, but during this time I was also pregnant, so I wasn't always involved. But if we go to the next slide, the supportive staff, if you can see the supportive staff, it says, it is kind and has a true and genuine passion for helping me. That was something that I felt very passionate about having that there, because like I said, I feel like I can tell when someone is genuine and they're actually helping me because they care about helping people and they care about, you know, their job and bettering. And so that was something important that I wanted to make sure that if someone is going to be working for the community, this agency is working for the people, that they're very genuine about the work. So yeah, this is something, like I said, it's a recommendation that I'm hoping that in the future, it's implemented into their practices, into the, like I said, the mayor's office, the city, the council of the city of San Diego. And I'm hoping that having this is more of a trauma-informed approach to working with the community, because I feel like not just me, but also a lot of people in my community can tell when someone is working to help them. And so, yeah, so for the next meeting, I was speaking with Dana, and what we want to try to reach out to different agencies that are already adopted this into their practices. So we're hoping to be able to reach out to them so they can give us like a quote or something of how it's impacted, and you know how that's been helping and how they feel, you know, just having this implemented, how they feel that now it's working with them. So yeah. Any questions, anybody? I know it's pretty fast.
Excellent.
Any commissioners have questions for Jessica? I'll go back to the recommendation just to see if everyone feels any questions about the recommendation.
So Jessica, again, thank you very, very much. That was excellent. The question I have, Dana, is similar to the other recommendation. Is there other material that will follow? And if so, what is the material so that the commissioners will be ready to have this would be a second action item, correct?
Yes, yes, please. Thank you, Chair, Dr. Hood. Yes, I will be attaching also the actual from the Clinton Foundation. And for anyone here who may not be familiar, the San Diego Foundation funded the Clinton Foundation to come here for a 3-year initiative titled Strong Families, Thriving Communities, focused on reducing disparities in child welfare and juvenile justice, specific to Latinx, African American, and Native American families in San Diego County. So this process, which took 6 months of working with inner city youth, of what their voices were on how they wanted to be treated by anyone in the helping profession, any service provider, cross-sector in a socio-ecological model. So the Clinton Foundation has a 1-pager. Jessica and I just teased it out so the font would be much larger and everyone could see the 4 tenets that are on this youth-led trauma-informed care code of conduct. So yes, that will be part of the attachment, also to attach to meeting minutes that Pastor Sandoval can share out with all the commissioners.
Okay. Any questions?
Oh, Elizabeth, Commissioner Bustos.
Thank you. And thank you, Jessica, for this wonderful presentation, and also Commissioner Brown. You know, from the Health and Human Services lens, this is all sounding very familiar. I do recall when I first came on board to the agency, you know, going a couple, maybe 2.5 years ago, it was at the agency level, it was Dale Fleming who was championing this. And I'm trying to connect the dots. And if there has been any momentum that's lost, we really need to, you know, pick those pieces up. So, you know, perhaps a follow-up, if I may request just a follow-up conversation, Jessica and Dana, or maybe you know now who your Health and Human Services Agency champions are, or did it,
Well, definitely Kimberly Giardina. Director of Child.
Okay, Kimberly, great. Dr.
Absolutely.
Giardina, great. Okay, so you're in great hands with her. Thank you.
Yep, absolutely. Thank you. Any other commissioner?
Pastor Sandoval? Oh, sorry.
Oh, no, sorry.
Yeah, one of the presentations, I think, when they presented the actual document, the trauma-informed care code of conduct document with the 4 quadrants, I think at that one, Nick Machion was there. And he was like, Nick Machion, and I think a couple of the county supervisors were there as well. And they were like, yes, we need to get this going. And so I do know there's a few nonprofit organizations already. They're pretty much, they're training this model with their frontline staff as a core competency when they evaluate their staff. And that's more on the program and practice model. But for us to really cement this, we really felt it necessary to put it on a policy level so that when like say the county or funding comes down, that if this document is added on as a mandatory training for staff, some of that wording, or they can just say, hey, this is going to be a core competency. I know they do like different expectations when it comes to the contracts of the staff having, different kinds of trainings, like sexual harassment trainings, cultural awareness trainings, a certain number of hours. This being implemented on a policy level, this could also be included on that list of trainings for the staff. That would be the ideal thing.
Jessica, please share.
Something else that I wanted to say was that just like how Pastor Sandoval was saying, was to this be implemented into staff. I don't know if anyone is familiar with the ACEs quiz. And that was something that I had to learn from Dana when I believe his name was Jamie Redford, who rests in peace. But when I saw Paper Tigers, that was something that just kind of relates to this as well, as how they implemented into Kaiser with quizzing the ACEs with their patients to see out-of-birth childhood experiences. So this is also similar to that, if anyone's heard it, I feel like, because they implemented this to have, be given these ACEs quiz to their patients to also just dig deeper into their past childhood experiences and not just what's their problem currently right now and how, ACEs also affects the reason, their visit today. So,
Yeah, so powerful.
Thank
And,
you.
and
Ruben?
Assistant Chief Ruben Leyva, please.
Jessica, it's great to see you. It's been a number of years since we've seen one another, but you still look the same. And you still have that energy that you bring and that passion around this issue. So I thank you for your continued championship of this work. You had such a traumatic impact on me, along with Dana, when it comes to trauma-informed care, that probation sort of played a big role in this initial rollout, along with HHSA, in wanting to see this trauma-informed care code of conduct be completed. And since then, probation has really tried to look through things through a trauma-informed lens. And when it comes to our officers who work with youth, one of the main things that we did was want to expose them to 4 mandatory trainings. And it wasn't just the restorative justice, which they got. It wasn't just the implicit bias training, which they also received, but we wanted to expose them to adolescent brain development to understand how the brain of the youth functions and develops over time and how it impacts decision-making. And a lot of the decisions that are made by a person in their youth are potentially impulsive and without a lot of weight given to the long-term consequences. But then finally, we also provided all of those employees with trauma-informed care training. And I was a part of that. And so I'm just happy that to see this work continue and to see all of you continue to move forward in this way.
Thank you so much, Assistant Chief Ruben Leyva. And Jessica Rivera, exceptionally proud of you. You are a phenomenal youth leader. You truly have reached into the heart and soul of people all over this world, literally, with presenting on this, on ACEs and resilience, and so grateful you're here. Thank you so, so much for your leadership. You're incredible. And Dr. Hood, were you saying yay, or did you have a question?
Hey, no.
Oh, okay, yay. Wonderful. Thank you so much. Any other commissioners' questions for Jessica? Okay, then we just have one more slide and the youth committee is complete. So our youth committee also, we had a collaborative meeting today. We are developing a youth-led train the trainer on ACEs and resilience. And it is a combination. Our wonderful Jessica Rivera will be there representing Youth Voice. We're hoping Community Rap, we're hoping Haley will join, Stephen Abrams from Team Enough, Rachel from Access Inc. Minor is looking for youth from Say San Diego, and it truly will be Aparna, who is a 16-year-old in Ohio, part of 16 Strong Project. She was one of them that spoke before the youth equity panel with Councilmember Campillo. Mika from 16 Strong, she's a sophomore in Ohio. Maya from San Diego Juvenile Justice Commission. So right now we have approximately 8 to 10 youth leaders that all of us as multi-generational mentors will be wrapping around, and they'll be guiding the development of this Train the Trainer on ACEs science. And as you all know, ACEs science is the epidemiology, neurobiology, biology, epigenetics, and resilience building. So it will be a holistic lens, and we're really excited about it, and hoping that it's done within about a 2-month window. So we'll share more at the November meeting. So thank you to each of you, and we appreciate your time, and very much appreciate Jessica Rivera and Stephen Abrams.
Okay. Commissioner Brown, stellar presentation, stellar information as usual, and thank you very much. Jessica, thank you. And the next agenda item, we don't have Commissioner Genevieve Jones-Wright, so the gang documentation ad hoc committee we will not hear from. So what I'm going to do is I'm going to go, I have a brief, and I mean brief, update on COVID-19. For those of you who don't know, I'm one of the tri-chairs for the county's advisory group on vaccinations and COVID here in San Diego. I was also appointed by Governor Newsom to a state committee that every time a vaccine comes out, we meet and talk about the issues, and just recently appointed to chair a national committee on COVID. So my part-time job seems to be COVID, but I'm going to share. So excuse the tardiness of this. There's some update data. This changes daily, well, weekly, sometimes daily. So you're getting information about 2-3 weeks ago. So these numbers aren't need to be updated, but what I'm going to show you will give you a very good idea as to how we are doing here in San Diego. First of all, this is the dashboard of the San Diego County COVID vaccination. So this is telling us how is San Diego County doing in vaccinating its population. So when we looked at the eligible population in San Diego County, and that's from age 12 and up, there are about 2.8 million San Diegans. Of that, 82.1%, about 2-3 weeks ago, had at least one dose of the vaccine, and 71 or 72% were fully vaccinated. I mean, that is significantly excellent when we compare it to elsewhere. What this slide is showing is how do we compare to the state? So if we go back to here, this is San Diego County. At least 182, at least fully vaccinated, about 72%. This is the state. So in the state, 66% of the state received at least one dose and 53% of the population fully vaccinated. So you can see San Diego County is doing much better than the state of California. And I can tell you the state of California is doing much better than other states in the country. So we're doing well, but in my opinion, not well enough. The other thing is we've had a huge focus on equity. Oh, I'm sorry. I haven't looked at these slides a while. What this is showing us, there was a question about the whole issue of the Delta variant. And as you know, there's the majority of cases are now the Delta variant. Most of the ones who are getting sick and in the hospital are because of the Delta variant. And it's made a significant impact. I thought this was very telling. What this is saying is that vaccinations are working. If you're not fully vaccinated, the case rate was 66.9% of folks who were this is the vaccination rate. If you're fully vaccinated, it was only 9.3%. So what does that mean? Most of the vaccines, the Moderna, the Pfizer, when they first came out, said they were 94, 95% effective. What that meant is 5 or 6% had a risk and did get the COVID, but usually not as severe. So none of these vaccines were 100% perfect, but they were excellent. Most vaccines, like the flu vaccine, 40, 50, 60% effective. This was 94, 95%. However, because of the variant, this number has gone up to about 9.3. But the point of this slide is that being vaccinated gives you 7 times greater protection than being not vaccinated. And now we're talking about hospitalization rates. For somebody who was not fully vaccinated, hospitalization rate was 1.6. If you were fully vaccinated, hospitalization rates were very low, 0.05. That is 32 times greater. So if you're not vaccinated, your chances of being in the hospital are 32 times greater than if you were vaccinated. So I hear a lot of folks say, well, you know, the vaccine, there are people in the hospital who are vaccinated. A lot of folks who are vaccinated are getting sick. What the vaccine does, even if you do get the COVID, is it prevents you from going into the hospital. And there are some other slides that show the death rate in the vaccinated is much less. So vaccinations absolutely work. The other focus is equity focus. And as you know, the county has funded several community-based organizations to focus on health equity matrix, to focus on certain groups by race and ethnicity. Why? Because many of those groups were at higher risk. And this is showing by race and ethnicity what percentage of the eligible group in that ethnic group has been vaccinated. And it may be hard to see, but the percent of Native Americans, Alaskan Natives was 43.7%, Asians were 68.6%, Black African Americans was 41.6%, Hispanic and Latino was 68.2%, Pacific Islanders 99, multiple races 99, white 61.2%. I think what's amazing is that in other parts of the state and country, we see Hispanics are less than whites, but here they're one of the highest vaccinated rates. So, and if you look over here, these Hispanics are in yellow. And then when the 12 years became eligible, their vaccination rates really took off. And this gray line here is African Americans. The purple line is Native Americans. And as you can see, they have the lowest vaccination rate. Now, although this group has the lowest vaccination rates, if you compare it to the state, if you compare it to the United States, this is much better than a lot of folks are doing. And to bear that out, if you look at Blacks who are partially or unvaccinated, I'm sorry, the Blacks who are fully or partially vaccinated are 37%. So add these two together. This is what's happening in the state. However, in San Diego County, the Blacks were up to 44. I think it's now up to about 45, 46%. So when we compared ourselves to the state, we're doing quite a bit better than other parts of the state and certainly other parts of the country, both overall and both on an equity ratio lens. One of the reasons why I think this has taken place is the county has identified about 6 or 7 community-based organizations, and each of them are focusing on certain populations. The Multicultural Health Foundation got a grant to focus specifically on African-American community. And I can give you another lecture later on about why African-American community is most resistant, whether we look here in San Diego, statewide, or nationally. They are the most resistant and therefore usually have the lowest vaccination rates. But with the grant, there was a huge media campaign. These are some of the billboards probably some of you saw around town. And let me see if this works.
Amazing grace, how sweet the sound that saved a wretch like me.
So that was at the beginning of the campaign, where we were trying to get folks' attention in the Black community, that if you get COVID, it can cause very severe disease. The next phase was verify and trust.
The COVID-19 vaccine was tested on over 70,000 Americans, including a significant number of African Americans, among them doctors, bus drivers, first responders, cooks, nurses, moms, dads, teachers, and preachers. The COVID vaccine can protect our community from the virus, especially those with underlying medical conditions. The only question is, will you verify and trust?
So if you clicked on verify and trust, it takes you to a website called blackcovidfactsSD.org, where the website is a lot of information, over 20 trusted messengers giving their testimony to getting vaccinated and why you should get vaccinated. There are issues around myths, trying to deal with those myths. Because of the Multicultural Health Foundation, which I'm very proud of, that took this on over a year ago in the COVID Equity Task Force, we received the 79th Assembly District's Nonprofit of the Year Award, and we were honored with a state resolution. And it was really the hard work of the community health workers who are actually in the field, going to churches, talking to folks individually. And I think this group had an impact, and certainly not the only impact, but had an impact in seeing African-American vaccination rates be better than most places in the state of California. So what I'd like to do is stop and see if anybody has any questions.
Dr. Hood, this is Ruben Lev. I just want to thank you for, sort of managing this at your level on all those different, areas that you've informed us about, and just sort of keeping so close to this throughout the last, going on 2 years, it seems like. You've just been a constant force and kept us all informed. So thank you for your job that you're doing. We feel safer knowing that you're involved. Thanks.
Well, thank you, my friend.
Yeah, I wanted to also take a moment and echo that sentiment. All that while you're still managing your practice and doing all the other, things that make you such a pillar in our community. I just wanted to take a moment and commend that and acknowledge you for all that great work that you put in. I know it's definitely not easy, but we see you, Dr. Hood. We see you.
Thank you. Thank you. Well, it's my passion, and to be honest, one of the reasons why I can do it is I have more time, because a year ago, my practice was taken over by San Ysidro. So all I do is just go in a few days and work. So I don't manage anything in the practice anymore. So that's really freed up a lot of time. So, but anyway, thank you so much. Commissioner Brown, is it Pastor Sandoval? I'm sorry, then Commissioner Brown.
Yeah. So I wanted to thank you on this topic because we did see your picture on that billboard on Euclid and Market Creek Plaza. And a lot of our mentors in our youth, they're very insecure and have trust issues with the whole COVID. Is it real? Is it not? The vaccination, there's a lot of stuff on social media. And so I said, look, Dr. Hood, he's on the forefront of this. If there was anything fishy going on, he would have told us, he would let us know. As far as I know, it's all good, it's safe. And so if there's anyone from the Cultural Foundation that can come out on any of our Monday night peace meals, that would be good, because they see your face up there and they know who you are. That'll just continue to bring that reassurance and that credibility to say, hey guys, it's all good.
So I will try to identify a community health worker in Pastor Sandoval for your youth group. I will make sure I show up myself to kind of deal with their questions. So thank you for that. Commissioner Brown.
Yeah, and I want to echo what the love that is being shown to you. You are a true hero and an icon in our county, in our state, and now you're a chair nationally. And you've been, I got my full vaccination through the Black Nurses Association. So I just admire you profoundly, Dr. Hood, for your leadership on behalf of so many children, youth, and families in our region. And our commission is richly blessed to have you sit as our chair, because you're an exceptionally busy gentleman. So we love you so much. We're so grateful for you, and thank you. Like Pastor Sandoval shared, there's so much more trust in all of this with having you at the helm. So bless you for what you do.
Thank you. I appreciate it. Commissioner Bustos.
So I had something to say about this. Okay, so Dr. Hood, thank you for literally being heartbeats on the ground. Now in my new wearing the jacket of government, I know all too well that there are certain conversations that perhaps we're not able to have, or we are not the best messenger. And our partnership with you, make sure that those conversations, the good conversations and the not so good conversations, happen and take place. So thank you for that. The other piece of it is, and yes, just a little bit of additional context. Many thanks to Dr. Hood's efforts and so many other partners here in the county, we are doing better, than other counties in California. But you know what? Lives are still being lost. Lives are still being impacted. So there's still a whole heck of a lot of work that needs to be done in this space to protect lives, to save lives. So, absolutely, please reach out to Dr. Hood. Absolutely, please reach out to me. I have a leadership role in the education and outreach, as many of you know, for COVID-19. And no conversation is too small or too big. Okay, and so just be very mindful that there's still a lot of homework that needs to be done, a lot of trust issues, barriers, but every life matters. Every life matters, and we're still in it. We're still in the trenches. So thank you, Dr. Hood, and everybody else. Do reach out. In particular, here at the county, also in partnership with Multicultural Health Foundation, there is now, because their voices are so critical, young adult and youth voices who are now also at the forefront of the COVID-19 education and outreach and saving lives. So that's a very important lens. So we can certainly do the peer-to-peer. So just please, none of us here sit in silence. And it's very important to not only survive, COVID-19, but thrive. And I'm just going to pause there. So thank you.
Thank you, Elizabeth. And I'm going to call Villegas, then followed by Jessica, and then Mario.
Dr. Hood, on behalf of our schools, I just want to thank you so much for all of your work with our communities. We do see those disparities in our schools as well, who's getting the vaccine access, right? The different clinics and ways in which our children and families can get information. So I want to thank you for your leadership, and I'll be happy to collaborate with you to see how we can reach out to other families, the different populations that you talked about today. And I wanted to use this opportunity, Dr. Hood, if it's okay, to share
Absolutely.
Our website for COVID-19 updates. I think it's very important for the community to know the information that we're giving in schools to families. So I will place some website links here. Please feel free to share with families. The first one is going to be for the COVID-19 status in the district, the dashboard that includes testing schedules, the vaccine, the way in which we have reopening updates, a lot of information for our families that I think we can partner in very powerful ways, Dr. Hood. So I just want to echo what Donna and others have said, echo the sentiments of you being a true advocate of our communities, and just a lot of appreciation for you for caring so much. And like Elizabeth said, so much and so authentically for our communities. So I appreciate you, and I want to thank you.
Thank you. Thank you so much. Jessica.
I just wanted to say, as I guess on behalf as a youth as well, I have not gotten vaccinated because as well, like how Pastor Sandoval was saying, like trust issues and all that. But I'm going to school to work in the medical field right now. And I heard that in September, working in the medical field, you have to be vaccinated. So that's something that I was like, okay, well, I have to do it. So there's no way, because that's what I want to do as a career. So I've, even since then, I've felt a little, like, well, this is not something that I wanted to do, but it was imposed on me. But hearing you, talking about statistics, showing us and seeing everything like the races and all that, like has made me feel more comfortable. So I just want to thank you, because tomorrow I have a vaccine appointment for my first dose. So now I feel a little bit more comfortable hearing that coming from you. And so thank you.
Yeah. Well, congratulations, Jessica, and thank you for that. You don't know how good you make me feel. I've been doing this a while, and I know in the beginning, when the vaccines first came out, we had more people that wanted it than vaccine. And every 10 people I talked to, 9 of them had their arm out. Where can I get it? It is absolutely the opposite now. Every 10 people I talk to, 9 of them are very resistant, kind of like Jessica. And we are in hand-to-hand combat with this virus. It is not just mass media, but it's one-on-one, coming to groups like Pastor Sandoval was talking about, taking times. I spent up to 30, 40 minutes talking to one person who wound up telling me no. I spent another 30 minutes, and then finally, a month later, they wound up getting it. So the vaccine saves lives. It saves resources. And one of the most resistant groups is the youth group. And I'm too old to convince a lot of youth folks. They usually respond to folks that kind of look like them. So Pastor Sandoval, I would be very happy to be in front of your group. Mario.
Thank you, Dr. Hood. I mean, in terms of continuing to be a part of the fight, I can remember the first presentation you did on the COVID back when our communities were wondering why we didn't have access to it. And you guys were doing those mobile stations. But what I also noticed is that the people who were showing up to mobile stations in Southeast San Diego were not from Southeast San Diego. They were from La Jolla. They were from other parts of the county. And yet our people were still not showing up. I'm still seeing that still happening today, but I'm really interested in, you mentioned Native Americans. And I was wondering, because, you know, we make up only like 1 or 2% of the county, if it's because of our low numbers as a demographic, or is it, even though we make up only 1 or 2% of the population in the county, that we're still not getting our shots? And my second question is, if it is that we're still not getting, like we're the least amount of people getting our shots, what is being done to get to the reservations? Because when you talk about distrust, I mean, there's no higher distrust in when Native Americans distrusting government, right? Because of everything that's continuing to be done to us. So what is being done to get the message out? Because our people are dying too of this.
Right.
And I just want to know if there's anything we can do.
Yeah. So as I said, the county, that's an excellent observation. And I think the whole historic issue and legacy of slavery and racism and the Native American community, the distrust is in the DNA. So even if you're 20, 25 years old coming from that community, you've heard stories and it's passed on. So I think there's a historic legacy. And every time I look, African Americans, Native Americans are the most resistant because of what you said. Your question is, what is being done? Well, to the county's credit, they allocated funding to various groups to target specifically ethnic groups. First time it's been done, especially in San Diego. When I first came here, nobody wanted to talk about race. It was uncomfortable. It was divisive, so they said. And so they would give a grant to go after everybody. But now they specifically gave funding to groups to target African Americans, another group to target Hispanics, and there's another group targeting Asians and Native Americans. Elizabeth, do you know the name of the group? That's good. Please. You're on mute.
And thank you, Commissioner Valladolid, for such a good question. Since the inception of really the COVID-19 education and outreach and really experience, here at Health and Human Services Agency, we did dedicate what I describe as a learning community that prioritized our tribal nations and our brothers and sisters there. So active outreach and education, eager though to continue to expand other opportunities, because again, it's just the gaps are there, the need is there, and the work can't be or shouldn't be, and we're working very, very hard for it not to be episodic. So if you have specific leaders, individuals, members of the community that we should be having conversations with, or we can cross-reference with, if you can share that with us. But I can let you know that just like we've been, prioritizing it through the work that Dr. Hood is doing, our Black American communities and also Asia Pacific Islanders and so many others, there's been a dedicated conversation since early on with our tribal nations.
Yeah.
But we can certainly do more.
Yeah, I think UPAC is one of the agencies that is targeting Native Americans, and I also think there's another I don't know off the top of my head. Any other questions? So
No, thank you.
you're welcome. So let me say this: this pandemic is not over. It's not through with us. I maybe several months ago I was hopeful we would be going back to school and going back and having this meeting in person without having to do a video. But because of the variant and the resistance out there, it's still a struggle. So I tell everybody it's all hands on deck, and I must say thank you for all your accolades. But it is really the 10-12 community health workers at Multicultural and all the other community health workers at the Chicano Federation, UPAC, all of them have community health workers. They're actually out there on the ground making this happen. I just happened to be the one that had the foundation that got the grant. So thank you, everybody. Really appreciate it. And I'm getting embarrassed, so I'm going to change the conversation and move the agenda and go to our illustrious Executive Director, Pastor Jesus Sandoval.
Thank you for the presentation, Dr. Hood. And concerning our tactical plan, if you guys go online, you can actually look at it and just help spread awareness of what we do. And one of the key performance indicators on the tactical plan is to help resource nonprofit organizations that may not have funding or program development. And there is departments, they're fully funded every fiscal year, like all the major departments. But when it comes to the nonprofit sector, grassroots, community mentors, I just want to bring this awareness. If there's any one of you that know of a nonprofit that is doing the work and they're doing it well and you want to recommend, I am giving out letters of support for when they apply for funding. And so far, I'm thinking about 5 out of the 6 that have applied for funding with the letter of support. I don't know if it's us that's making the difference or not, but they've gotten funding. And so that's one of our key performance indicators. So just want you guys to know that as commissioners, if there's an organization that's doing the work, them, they can come and introduce themselves. And especially right now, because resources are low, we can do that and tie it back into our key performance, tie it back to our tactical plan. An update for our Seasons of Peace, the city attorney.
Pastor,
yes.
Pastor, could I just make because this may seem timely. There was a presentation that I heard from Andrew Strong, who is the first Director of Office of Equity and Racial Justice for the San Diego County. And part of his presentation, he talked about funding specifically available targeting youth. And some of the criteria he outlined seemed to fit many of the organizations that some of the individuals on this commission and folks that could benefit from. Okay. So I wanted to work with you and my other commissioner, Elizabeth Bustos, of maybe having him speak to us at the next meeting, because I found the information very helpful, and I was surprised at the amount of funding they had. So
awesome. Okay. Thank you for sharing that. An update for the Seasons of Peace, the city attorney, on the city side, they're finalizing the verbiage on the contract between South Bay Community Services and some of our mentors that are going to be actual subcontractors to help provide those services. And so we're also tapping into the lowrider community. A lot of the lowrider communities are either former gang members from the actual gangs that are going at it with each other currently. And they want to give back to the community. We just had a lowrider cruise for peace. It was very successful. We did a cruise throughout most of the districts, and then came back. It was about a 2 or 3 hour for peace. And that being said, any of your organizations that would like to have training on why there's an uptick of violence in specific neighborhoods, we have mentors that are from some of those gangs that are willing to do a Q&A session or a gang panel training for that. However, because they're not funded, I am asking for a stipend-based out of training budgets or whatever to help them get compensated for their time. You know, a lot of them might work at the shipyard, they do side jobs, and they'll do this for free anyways. They do it. But on my end, I'm not making any promises for funding when they do that. But if we can do that for them as a stipend, we got gang members from all the different gangs in San Diego that are willing to do this. One that's on the line right now, former gang member, Robert Ontiveros. He was one that was on a documentary recently that came from Michael Kirsch, an investigative reporter. He came and he followed him around, a couple of our other guys, and it was uploaded to YouTube. If you guys want to watch it, all you have to do is Google "leaving gangs." It'll be the first one that comes up. It's got about 1.6 million hits already. And so if any of your departments like the schools, middle schools, high schools, elementary, probation, law enforcement, anyone would like to have that 2-hour presentation, he's putting together a proposal for a 2-hour session. So that, and then out of that 2-hour session, having 2 or 3 mentors that can share their story and have a Q&A, and then they'll get a stipend for that. So that's what I would like to set up for them if it's possible. And you can always come out and shadow us. Any of the commissioners, if you want to know some of the work that we're doing on the groundwork, just let us know. I know right now it's the COVID, it's you know, some feel comfortable coming in person, others in Zoom. But we have things going on with the programs every single day of the week. Business hours, after school hours, weekend hours. I mean, this is an around the clock approach, wraparound approach we're using with all of our partners. So if any of you, most of the nonprofit organizations like Paving Great Futures, Mothers with the Message, UPAC, Youth Empowerment could use volunteers and are recruiting for mentors as well. So a mentor doesn't just have to be someone with lived experience. It could be someone that offers a resource to a youth, to a family, and even support for the actual work that's being done. And so I just wanted to throw that out there as well. Robert, are you there?
I'm here, sir.
All right, you want to share just a 2 minutes of who you are and what you're doing in the community?
Okay. I'm in my car, guys. Sorry, I was out there playing football catch with my son, and Pastor Sandoval hit me up and said, "Hey, get on this Zoom meeting." Sorry, guys. Here, I'll show my face a little bit. What's up, everybody? What's up? You guys can barely see me. Anyways, my name is Robert Ontiveros, former gang member for East San Diego, and AKA, they just call me Termite. They call me Rob Dog now. Changed my life. 25 years to life. I was looking at in prison, got out, and you know what? At the age of 20, did not go back. Now I'm a business owner, giving back to the community, a community mentor. I've worked with several people on this call that are on this call, several great people in the community. And I'm all about giving back. I'm all about the love. I'm all about collaboration, everybody working together. And that's how we get things done. Right now, I'm just doing work with youth empowerment, with art, and did some events for him, as far as with some of the kids that we took some kids to Aquatica to jump around, and I was the event coordinator. And it's something that I do as well, as far as coordinating events, like the fishing event that I have. That's also on YouTube. You guys can look it up. It's collaboration. Basically, I grabbed every organization that I could and brought them all together. We're talking all the way up to Oceanside, Escondido, different gangs, having them all together and just go out on fishing. And it was an amazing time. And they were from different gangs, and they were just all having a good time, because that's what it's all about. So that's a little bit about myself, but I'm here. You guys all know me, and just give me a call. I'm here to help. So whatever I can do. I appreciate you having me on this call, and thank you. I hope that was 2 minutes.
Thank you, man.
Peace.
All right. And also for the community wrap, our peace meals, they could still continue every Monday. So any of our commissioners are invited to that. We eat dinner together, and then we have guest speakers come in, resources, something tangible for the youth and the families. That's every Monday at the church from 6 to 7:30. The last Saturday of this month, we have a mental health aid, MHA training for our mentors. That's going to be a full 8-hour training on mental health we try to get all of our mentors as many as trainings as possible, certifications, just to add to their resume. And so that's every Monday. And then for announcements, our cash meetings are the second Thursday of every month from 8 to 9 a.m. And I know some folks on this call join us, so we appreciate that. But if you want to know more information, detailed information of what's going on in the community, I suggest you come to that one. And there's a lot of networking and just that happen at that meeting, good connections that are happening. And I know it's getting late, so that's all I have for now. I'm not always available, but I'm always accessible. All you got to do is shoot me either a text message or an email. And so thank you guys for your support, for your heart, for all your involvement that you do on a day-to-day. I know that you're passionate about the work, and we are getting other cities, other states that want to use the model that we have, the collaborative model, to help tackle the issue of crime and using the wraparound holistic approach. So we thank you guys for that. And if there's any questions, comments, or concerns, right now is the time, or forever hold your peace.
I want to applaud you for all you do, Pastor. I see you everywhere. And a few of the folks I've come in contact with, when I told them that I work with you, I got cred. So thank you for what you do. Are there any other announcements from any of the commissioners or anything? Okay. Elizabeth?
Oh, how did you know? I was trying to navigate my hand up situation here. Okay, so a couple of things. Happy to assist Dr. Hood and Commission to coordinating a presentation from Andrew Strong, the Executive Director for the Office of Equity and Racial Justice, number one. Number two, I also for the past year have had the privilege of helping to staff and to provide technical assistance to the Leon L. Williams Human Relations Commission. And this is literally hot off the press. They have a series of subcommittees and that have been formed, are being formed. And the next one coming up is the Youth Advisory Subcommittee. Okay, so keep an eye on that one. Happy to share information on that, because I cannot imagine moving that subcommittee moving forward without voices, that each and every one of you touch. So be on the lookout for that. And then I had one more to share, but maybe not really, except expressions of gratitude, dear Pastor Sandoval, for everything that you do for us, and to especially, help protect lives in our community. All is well with you. So thank you. Thank you.
Thank you, Commissioner Bustos. Any other announcements? Okay, then I'm going to ask commissioners a motion to adjourn.
I'll make a motion to, I think that's what it.
Okay, it's been motioned by Vueto, second by Dana. All in favor?
Aye.
Have a wonderful
Aye.
evening. Have a wonderful Labor Day weekend. Bye, everybody.
Much love and light.
Thank you, everyone.
To you.
Have a great night.
Bye.
Bob Dog.
Good night.
What's up, man? Oh, we're still recording, huh?
Yeah, I'll call you later, brother. Call me.
All right.
Wait, for anybody who's still on here, just really, I remember, okay, so this really matters, even if it's just the 4 of you, but get the word out. So y'all know about what's happening in the corner of Euclid and Market, right? It's the Southeastern Live Well Center.
Yeah.
Okay, and all along, organizers from the county side have worked really, really hard to include community voices and community perspectives and spirit. Okay, in every piece of the planning. Thank you, Pastor Sandoval, for serving on the technical advisory committee. Having said all of that, okay, there are 2 opportunities that remain for, I believe, youth involvement. Okay, and that, are you, okay, so there's a mural committee and an arts committee, okay, that are being convened, to help inform, the art spirit and the mural spirit, that's going to be woven throughout the building. And we are having, understandably so, and for many reasons, a difficult time identifying youth, who will be willing to lend their voice to this. I think it's about 3 meetings, but if you know of anybody, or even, you don't have to be a youth, Beto, anybody here, Robert, okay, who would be interested in participating, hey, you've got an in and it's with me. Okay.
Oh, yeah.
The opportunity closed, but look, we need your voices. We need, and I'm going to keep it real here. So it's kind of serendipity that the 4 of us are here. We are in desperate need of Latino voices.